Hi, my name is Dr. Wellens and I'm here to talk to you about Achilles tendon tears or Achilles tendon ruptures. So huge topic, especially in sports medicine. Very common injury, occurs in athletes, but we see it in older population as well. So let's kind of step back and review the anatomy. So this is the tendon called Achilles tendon. It's in the back of the heel. It actually goes all the way up the leg. And one of the components of the Achilles tendon inserts above the knee, one just below the knee. And basically the two muscle bellies come together and then they insert into the back of the heel right here. So where do we see majority of the Achilles tendon tears? Actually right there. So not at the insertion, but approximately 2 to 3 centimeters proximal to the insertion of the Achilles tendon. It's called watershed area. So this is the weakest part of the Achilles tendon. And I would say 99% of all Achilles tendon tears that I see are actually just slightly above the insertion. So what are the treatment options? Well, depending on what type of an Achilles tendon tear you have, and also how active you are, your age, and your physical activity. And that would take me probably 10 minutes just to go through all the different variations. But bottom line is, if you have a complete Achilles tendon tear and it's not addressed immediately and it's something that you walked on for a couple of weeks, most likely you will need surgery to get it repaired. The good news is there is a minimally invasive procedure now. The incision that I make is only about 3 to 4 centimeters, and there's a special mechanism how we can actually pull the tendon down and reconnect it to the distal portion of the tendon with a very, very small incision. Usually I will involve a graft and I will wrap the graft around the tendon to reinforce the repair. But unfortunately, you still have to be non-weight bearing for 4 weeks after the surgery. We start rehab pretty fast, but it is a big ordeal because Achilles tendon ruptures usually take at least 6 months to a year to fully recuperate. The key is immediate surgical or medical attention. So there's a couple of papers that are written recently showing that if you're not a professional athlete and you immediately have medical attention for the Achilles tendon rupture, basically you do not need surgery. You can try immobilization, casting in a plantar flex position to see if the tendon will heal up without surgical intervention. Unfortunately, you do have a higher chance of re-rupture, and that's a big one for me because my athletes, they come in and they say, listen, I was treated last year for a partial Achilles tendon tear and it healed up, it was never the same, and now I'm re-injuring it, and they have a complete tear because we do know with conservative non-surgical care you have a much higher chance of re-injury. But on the other hand, if I'm dealing with somebody who is a diabetic or a smoker and they have a complete tear, we definitely are very conservative in when we actually are going to go in and repair this tendon, just because the complication rates are much higher. And of course, with smokers, we always have a problem with healing the wound, just because the circulation is definitely compromised with nicotine users. So it really depends on what type of Achilles tendon rupture you have, what is the correct treatment approach, and a lot of it has to do with where you are in your rupture treatment, because if you're only a couple of hours from when you injured it, your treatment might be very different versus somebody who walks into my office and I'm the third physician that they're seeing, and it's been 8 weeks, which is really already considered a chronic rupture, not even an acute rupture, because obviously the tendon will start traveling up the leg, and so a lot of the times we cannot even get it with a small incision. I have to make a large incision to go in and pull this tendon, and sometimes I even have to lengthen it if the tendon is very contracted, meaning I have to make it longer. So bottom line is, if you have an Achilles tendon tear, you need to call us, you need to address it right away. You don't just let an emergency room physician guide you in what the appropriate care is, because there's definitely an expertise and there's definitely a lot of little details that make a very large difference at the end of your Achilles tendon crusade rupture treatment protocol. So call us, we're available. We have same-day appointments. Do not let an untrained professional decide what is the best treatment protocol for you.